Hypertension in children. The people used to say the children do not have hypertension. We used to believe earlier, but nowadays it is not true. 25% of the global population are found to have hypertension, of which 4% are children. So what is hypertension? Systolic and diastolic BP more than 95th centile, measured on 3 occasions in basal state, is called hypertension. And your what are the pediatric causes of hypertension? You know, the incidence of lower than developing nations is quite high, 15% to your 22% something. So these children have low nephron endowment, and obesity is also growing on the other side. 20% of the children are obese in Bangladesh, in the city, and 8% in the village they are obese. So the both obesity and low birth weight, your malnutrition. Children staying in the nowadays people are living longer, and the neonatal care, the care incidents, ICU care, they are increasing. So these children in the care associating 30% of the children has AKI. So in the long term, acute AKI means acute kidney injury. So in the long term, these children are developing CKD. They can have hypertension. So then apart from that, you have the other organic disease, kidney diseases commonly, renovascular hypertension, undetected, remains undetected, and also renal hypertension and endocrine causes and rarely cardiac causes. So these are the causes of hypertension. They are to be addressed, and then your when you are not sure about the BP, one record shows this, another record shows that. So you be sure, make 3 reading. And when still you are not sure, you are seeing different sort of variations. So you go for the ambulatory blood pressure monitoring and home blood pressure monitoring. ABPM or ambulatory blood pressure monitoring is good. It's essential, good amount of time. And then your so they, if you get the hypertension, diagnose hypertension by measuring 3 times, and then you're certain, then what you are going to do, you are going to find out the cause. By far, the commonest cause of hypertension in children is pediatric is CKD, chronic kidney disease. In fact, 20% of the pediatric hypertension are due to CKD. So there are 3 tests. One is the your urine RE, microscopy, sediment, RBC, proteinuria, and your other one is your creatinine, and ultrasound of the kidney showing the smaller kidney, corticomegaly differentiation poor, increased corticogenicity, and structural abnormality, cause of the CKD. If they are there, it is CKD. And then at times you do not have this. If you find obese child, obese child, no, you do not need to investigate much. So do the other things like blood sugar, lipid profile, and and refer to your dietitian. And then in the endocrine causes, you have hyperaldosteronism. Also in monogenic hypertension, you have hyperaldosteronism. So window to hyperaldosteronism is the serum potassium, which is a little bit raised, and your aldosterone level, renin level, they are also raised. So kidney, I said earlier. So how to treat hypertension? Irrespective of the etiology, best drug for is the RAS blockade, renin angiotensin aldosterone blockade. AC inhibitor and ARB are the 2 drugs in this group, and globally they are used except in acute kidney injury, except the renal artery stenosis. These 2 drugs are the first drug because they reduce the progression of CKD and thereby ESRD, and thereby the need for dialysis and transplantation, they are less. So second choice may be the calcium channel blockers. Your dipyridamole containing calcium channel blockers, they are antiproteinuric, antihypertensive. The proteinuric hypertension, they are useful. And the third drug may be the beta blockers. They are useful in the child who has tachycardia. And fluid overload, you have better choice is the diuretics. At times you need to combine 1, 2, 3, 4 as much as needed. Keep BP on the safe level below 90 centile, preferably in proteinuric hypertension. You keep it is around 50 centile and low, but do not go below 5th centile. And in the non-proteinuric hypertension, it is 75th centile. Even in round figure in adolescent child, like adult, it should be around how much? 100 by 70. Below it is 90, nice, acceptable. 55, 60 also acceptable. don't go below. But 50% of the global population with hypertension, they do not know that they do have hypertension. The other 50% who know their BP is high, they do not have adequate control of BP. So in that way, we are treating only 25% of the hypertension appropriately. And number one cause of death globally, hypertension, heart failure, and stroke, kidney failure. They are the common cause of these three organ damage by hypertension is the commonest cause of death globally, leading to loss of a huge amount of population and also disability.